Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with a March 22nd, 2021 update from the Dubuque County Public Health Incident Management Team. Dubuque County's COVID-19 new case trend line is trending downward with 51 cases reported in the last 7 days. And even though we've been experiencing fewer cases, more people are traveling and more of our community is open, so community spread is still entirely possible. So if you are experiencing any COVID-19 symptoms, which often mimic a cold or mild illness, get tested. Testing appointments are available through both Test Iowa sites at Epic Health and Wellness and Grand River Medical Group, usually the same day or next day, and also through your healthcare provider. Another thing to think about with potential symptoms, although fever and loss of taste and smell are key symptoms for COVID-19, they usually don't show up or are even noticed until several days after a person's been infected. And fever and loss of taste don't happen in everyone who are infected. So if symptoms occur, such as cough, shortness of breath, fatigue, sore throat, runny nose, congestion, get tested. It's still a very important tool we have to slow the spread. Another way to put the pandemic and community spread in current perspective is regarding our death rate. COVID-19 is the #1 cause of death in the Americas. Yes, North and South America. 1/3 of all deaths occurring in the Americas are due to COVID-19. Dubuque County continues to successfully administer all of the vaccines we are allocated, either from the Iowa Department of Public Health or the Federal Retail Pharmacy Program. As of today, 17,259 people have completed their vaccination series, which is just about 22% of those 16 years and older in Dubuque County who would be eligible to receive a vaccine. An estimated 87% of those age 65 and older in Dubuque are currently vaccinated, which is the group most affected by severe illness and the number of deaths. For information on current vaccine appointment availability, your best bet is to go to the vaccinefinder.org website. For those of you who do not have access to the internet or electronic scheduling, particularly those 65 years and older, the state has set up the 211 phone line to assist you, so just call 211. Also, for those without a healthcare provider, you can leave your name and contact information on the Dubuque County Sleeves Up phone line at 563-587-4950. And when vaccines are available, you'll be notified for an appointment. Earlier, I mentioned the risk of new cases and increased transmission with travel. And I know my main focus here is COVID-19, but to add it on top of everything else, the CDC is also recommending risk assessment and post-arrival management of travelers from countries with Ebola outbreaks to prevent the spread of that disease. Although risk in the U.S. is low, there are 2 ongoing outbreaks of Ebola viral disease, one in the Democratic Republic of the Congo and the other in a forested rural region in Southeast Guinea. Yet another reason to do more planning before you do travel. As we settle into spring and keep up with masking, social distancing, and hand washing, do a check-in with your mood and how you're feeling emotionally. It's been a long year, so remember to get some fresh air outside and physical activity, which is known to improve mood and general outlook. Also, reach out to others, both if you need someone to talk to or someone you know is by themselves or just needs a lift. We're getting through this as we continue to be all in this together.